Welcome to this week's interview. Today we will be having a special guest, Dr. Susan Sanders.
Hi.
Hello, Dr. Sanders. Dr. Sanders is a local chiropractor in the Port St. Lucie area, and she will be here today to answer a few questions about chiropractic.
Okay.
Okay. First, some background information so that we all know some things about you. The first question is, how long have you been a chiropractor?
Over 12 years now.
Okay. That's a pretty long time.
Yes, it is.
Where did you go for your degree?
At Life University in Marietta, Georgia.
In order to keep your license, you have to go back to school periodically. How frequently do you have to do that?
It's a matter of hours, not a matter of frequency. I have to do continuing education courses for approximately 40 hours every year, or every other year, depending on which state. I have 2 licenses.
Now, why do you have to go back?
Because things change in the world and information becomes either new or different, and I have to be updated on what's new and important.
Interesting. Tell us about being a chiropractor. What exactly does that mean?
I help patients of varying ailments, most of them musculoskeletal in nature, but I help a lot of patients. I've had patients with stroke, I've had patients with autism, I've helped elderly patients, just varying things. Typically in my office now, I help personal injury patients, which means they have either been in an automobile accident or they have been in an accident on a job.
All right. Would you like to tell us about any common misconceptions about your profession?
My favorite one is, my doctor cracked my neck. I don't crack necks. Cracking necks implies a fracture. A fracture sent you to the hospital. I would like to not do that. That would be a bad thing. Apart from that, chiropractors cause strokes is a very wonderful one to hear. Most chiropractors do not cause strokes. I have yet to meet one that does. Strokes for patients typically happen because a patient has a historical background, a relative, usually a parent or a sibling, with a history of stroke or cardiovascular disease or anything like that that would be a danger to them receiving an adjustment. A good chiropractor would inquire as to a patient's history to avoid these things, and if it is in their history, like I said, I've had patients who have had strokes. I alter my treatment to accommodate their needs.
That's very interesting.
And long-winded.
That's fine. So what's the difference between a chiropractor and a medical doctor?
A medical doctor and a chiropractor. If you examine course by course, a chiropractor has more experience in the realm of musculoskeletal and radiological, which is x-rays, studies. A medical doctor has a much extensive study in medical pharmaceutical needs, because that's what they deal with on a daily basis. You come in, they give you a pill, they send you home, or they give you a test and they send you home. In my office, we deal with the human frame and we help the body to improve its own function so it can heal itself. So we deal a lot with physical medicine, realignment by hand or by tool of any joint in the body, including skull joints and extremity joints, which is shoulder, elbow, knee, anything like that, as well as the spine.
Many people have said that chiropractors are medical doctors in a sense, and have been taken to court over this. Has this ever happened to you?
To me, no. But it has historically happened. A long time ago, I think in the 1920s to 40s, somewhere in there, medical doctors decided that chiropractors were too much competition, and they started having them arrested for practicing medicine without a license. These chiropractors, of course, declared themselves as practicing a unique form of treatment for patients, which medical doctors do not do, and despite being arrested, their patients would come and get treatments in in jail until their cases went to court and they were all dismissed. Eventually, chiropractors had to take the American Medical Association to court, which went all the way up to the Supreme Court to prove that, one, we were functionally unique and distinct and not related to medical in any way, shape, or form, and two, to prove that they had been trying to stamp us out as a profession in a legitimate way so that we could get them to stop, cease and desist.
That's very interesting.
Thank you.
Is there a certain point at which you, as a professional chiropractor, decide you need to refer a patient to a surgeon?
I do that in my field, in my job with personal injury, either every day, every week. At least for every patient, we refer for a referral to see if they're even eligible for any additional medical needs above and beyond what we provide. So yeah, I send patients out for MRIs. If I can't get an x-ray that I need, that an MRI place can take additional to what I need, I send them out for those. I work with you've never heard this word before, it's a medical doctor called a physiatrist, which is actually a medical doctor who studies in musculoskeletal, but he still only deals with medicine and testing. But we work with other doctors all the time. I have a spinal surgeon I refer to frequently now, and a orthopedic specialist who I refer to quite frequently as well.
Thank you. In your years of being a chiropractor, what have you found are the main reasons that teenagers specifically need to go to see someone with your job?
Teenagers are a product of their lifestyle. A lot of them have sports injuries that go untreated over the years. If they pursue a sports career, a chiropractor in their life is a very wonderful thing. I had a quarterback that I used to see. His arm throwing ability improved, he said, because of his chiropractic skills. I saw a teenager who, she wasn't an athlete, she was an actress and a model, and she improved very well throughout chiropractic care in my office and then proceeded to become the star of 90210.
Wow.
I love her to death. Anna Linda Cord. And, let's see, I've had many other patients, young and old. My youngest wonderful case was an autistic little girl who, after 6 months with treating with me, after not being able to laugh, she was able to laugh on her own. And in the beginning, she could only cry instead of laugh. And it was just because her neurological system was a little confused, as well as being very toxic. And her mother was working on her part by doing diet changes, and I was working on my part by doing as much detox work and correction to her neurological system as I can possibly do. And she responded very well and came up to me one day and said, "Doctor, you changed me." And that was very touching.
That is very touching. What are the most common problems that you encounter among teenagers?
Again, usually musculoskeletal due to falls or accidents or sports injuries.
Do you recommend any ways to keep from having serious back issues later on in life?
Oh, yes, I do. The biggest one is probably going to be stretching. Most people don't stretch. Cats wake up in the morning, first thing they do is they stretch. Dogs wake up in the morning, first thing they do is they stretch. People wake up in the morning, first thing they do is go grab a cup of coffee. It's a big difference. A lot of people grow up and grow stiffer and stiffer and stiffer. I see a lot of people who are older in their spines before they should be. Osteoarthritis sets in because they don't know to take care of themselves. They don't have the time to take care of themselves. They never heard about taking care of themselves. Stretching is very wonderful. Chiropractic care, unfortunately, comes in after these people don't take care of themselves.
Thank you. That was a very informative session. That's all we have time for today, folks.